Okay, good morning. We're here for our weekly Marion County Board of Commissioners meeting. It's Wednesday, September 4th, 2019, and it's 9 a.m. We're here in the Senator Hearing Room at 555 Court Street, Northeast in Salem, and as always, we start with the Pledge of Allegiance, if you'll join us. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So, public comment. David, you're here. You're signed up. Come on over. Good to see you as always.
Thank you, Commissioners. I'm asking the county on Bridgeway for funding for that for 2020.
David, could you pull that closer? I can't hear you.
Pull the microphone. Yeah.
I'm asking the county to approve Bridgeway for Marion County funding for 2020 for next year for services and needed for special, all the services needed for emergency for the county. So I'm asking the mental health get the funding for it this year and next year, soon as possible for the county. Thank you,
Okay.
Commissioners.
Yeah. Thank you, David. We're going to do an action item later on today that has something to do with that. So thanks for being here.
Thank you.
Morning, Commissioner. Morning. And we just finished public comment, and we're going to go right into the consent calendar, and I believe it's your turn.
Mr. Chair, I move that we adopt the consent agenda under Board of Commissioners OLCC application. I recommend approval of Tiari Wine Company, LLC, DBA Tiari Wines, LLC in St. Paul. Stafford Beverage, LLC, DBA Stafford Beverage at Lancaster Liquor in Salem. Approve Marion County's grant application for the Oregon Department of Veterans Affairs funds for fiscal year 2019-2020. Under Business Services, approve a recommendation to inactivate classifications number 77, breastfeeding peer counselor, number 123, dog control officer trainee, number 356, civil engineering trainee, and reactivate and approve updates to the language for classification number 118, county building official. Approve an order to adopt revised administrative policy number 604, nepotism. Approve an order appointing Debbie Gregg as a voting management representative to the Marion County Health Insurance Study Committee effective September 4th, 2019. Under Community Services, approve an order allowing a one-time dog license fee waiver for Marion County dogs participating in the licensing and vaccination clinic being held on September 7th, 2019. Under Public Works, receive notice of hearing officer's recommendation and schedule a public hearing for October 2nd, 2019 for Zone Change Comprehensive Plan, case number 19-001, Chris Clements for property owned by the State Grange of Oregon, patrons of husbandry. Under Treasurer's Office, approve an order to reclassify and increase the Public Works Environmental Services Salem Kaiser Recycling and Transfer Station Change Fund from $850 to a total of $1,300.
Second.
Yeah, motion and second. Any further discussion? Seeing none, all those in favor signify by saying aye.
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 Aye? Okay. Our first action item is under the clerk's office. Is anybody here from the clerk's office? Chair asks permission that we would just set aside the clerk's office to another item or to later on in our agenda. Seeing no objection. Under Health and Human Services, our next action item, consider approval of an intergovernmental agreement with the Oregon Health Authority for incoming funds in the amount of $1,206,936 from Marion County to provide choice model services retroactive to July 1st, 2019 through December 31st, 2020. Good morning.
Good morning.
You're here.
I am with a cold, so I hope I get through this. For the record this morning, my name is Carrie Muller, and I'm the administrator for Marion County Health and Human Services. And with me,
Alexis Cruz. I'm the program supervisor for adult behavioral health services.
So the first item for you this morning is the intergovernmental agreement to approve choice funds. I'm going to let Lexi talk a bit more about what that is, but for probably more than 10 years, we have been under contract with the state of Oregon to provide services for individuals who are transitioning out of the Oregon State Hospital and from higher levels of care, so group home, foster care services, to living their best life possible in the community. So we've got a lot of services and supports that we provide to individuals, and Lexi's going to talk a bit more about that.
Thank you. Yes, currently choice service model funding supports about, I want to say about 300 folks with the significant mental illness challenges. Through this process from the state hospital into our local licensed residential care, we support these folks as they work towards integration into the community. We do that with wraparound services and with peer services. We also have an assertive community treatment team, it's called ACT. That is also a service that team that we provide in the community for folks who have more challenges about getting into their regular office appointments. So we do the work out into the community to help support them. These funds also help support rent subsidies and any other kind of barrier removals to help folks really truly integrate into the community.
So would Mr. Beam qualify under this program to integrate? Because he's been integrated in the community quite a while now.
Yeah, the services and supports that this funds is for folks with significant mental health challenges,
Okay.
as opposed to folks with intellectual and developmental disabilities. Those funds come through DHS.
Okay, right.
And is this only for folks who come from the state hospital?
It's for folks who are at risk of going to the state hospital, who have come from the state hospital, who are in acute care or short-term psychiatric facilities, folks in the community that without these supports might be going into an institution. So it's both transition out of the institution and diversion from higher levels of care.
And so the folks in the community, how do we determine who gets into this program?
I think our prioritization is folks that are at the state hospital level or at risk of the state hospital level. We've had a shift with this population in that we're doing able to do a lot more diversion to the state hospital. We had consistently had probably about 17 or so on average every month that were residing at OSH, and then now we're through a lot of diversion supports and a lot of movement, we're down to probably about 4 or 5. So those are the priority folks. We're doing a lot more work at acute care to be able to divert folks.
So these dollars were directed to the community as a result of the Oregon Department of Justice involvement, Oregon State Hospital, about 10 years ago, as I said. And although the need is significant in the community, we have some contractual obligations to get folks out of the hospital as soon as possible. So that really was initially the target population. And then there were some incentives built into the contract to try to reach people before they head to the state hospital. So it's really changed, I think, our relationship to the hospital, in that they see us as a critical partner in the community. And so the state really dedicated some resources that has historically been at the state hospital to the community to really do this work in support of the involvement with the Oregon Performance Plan and the Department of Justice.
Got it. Very good.
So I guess that leads to one more question I would have. How is this funding compared to the past? Because I know in our corrections department, we are not getting rewarded very well for the good work we've been doing.
Right. Thank you. That's a great question. And we've had a funding formula, and the legislature agreed to bring a work group back to the table to talk about that. The funds were diverted in some of our other categories to support this population. And that funding model that I was referring to had to do with civil commitments, so people who are civilly committed to the state hospital. And because, as Lexi described, we have 2/3 less individuals on average at the state hospital, we had been penalized for that. And so they've agreed to come back together to look at that model and really reward and support individuals living in the community at the best level that they can. So that's their commitment, and that work should be happening soon.
I'm going to say this on the record. I don't know why we try to do good work. Because every time we do good work,
Punished.
they kick us in the teeth. I mean, never mind, don't get me started. Yeah, you get punished for doing a good job instead of being rewarded for doing a good job. It's our community corrections department, our health department, and it's just so easy to just take that money and just say, give it away, because who's going to advocate for it?
Right.
You don't have 10,000 teachers or students standing on the doorstep that is really important for these people. Okay, I got started, I'm going to stop.
One more.
Go ahead, Commissioner. It's like, I'm starting to be like him over here. It's like, I want to say it like it is.
It's good. No, it's important. I really appreciate the
We're
advocacy.
Next, when this comes up, when that work group, Carrie, keep us involved, would you please?
Oh.
Because this is the kind of thing we need to really make sure our state delegation, our representatives and our senators are aware of how important this is and how backwards, upside down it is when it comes to the funding of people who are doing a good job. So.
Yes, thank you. I appreciate that invitation. AOC and AOCMHP will be another venue where we'll be working that, so we'll
Okay.
be sure to keep you involved.
You want to go? or you
Well,
want him to go?
just because it's my little normal thing that I worry about. These are people coming from around the state, or these true Marion County residents?
These are Marion County residents.
But were they originally, or they become ours after they've come from somewhere
I'd
else?
say the majority of them are people who have spent their lives in Marion County.
All right.
But as you know, Commissioner, with the concentration of institutions in this community, we do get folks who come here after they've been discharged from other institutions.
Well, this may not be a perfect example, but my argument is that they come from around the state, and we need special consideration because we're carrying the burden for so many other counties that in my language, fawn it off on us.
I will bring that to the
Thank you.
conversation. Thank you.
There's one north of us.
What are some of the challenges that are sort of forefront in your mind when you administer this program? What are you dealing with right now?
I think a lot of the challenge is to be able to, one, for these folks to have a concept that they can actually be in the community. For so many years of being institutionalized, they were told that this is where you're going to reside, and you can't do a whole lot of things. Whereas in the last several years, we've been able to open up conversations about, they have hopes and dreams, and, some of them can work, and which we fully support, and being able to do a daily life. So I think the hardest challenge we have, we had to open up our our licensed residential beds in order to get people to move through that. And with the help with supportive housing, we were able to do that and be able to wrap some additional services around them. So that has definitely helped a lot. But I think, what the barriers that continue to happen are the rents and the subsidy that we still have to, do to help support folks. The behavioral supports, we have some folks who at some point decide that they're doing okay enough and they don't want the supports, and really they do need some support. So we, have those challenges. It's kind of like a roller coaster, but we're there to do that. But I think probably the most significant would be the rental subsidy supports.
Because it's just hard to find housing for the folks that you're working with, is that?
It is hard to find affordable housing. And some of these folks also have maybe some charges from when they were not in a great state of being as a result. And so having to kind of go through some of those. We've done a lot of work with collaborating with various apartment complexes and such in the community, and that's been very helpful, and they see our staff there regularly to help support people.
Very good.
That's
Thank
helped.
All right. If I could, Chair Cameron, I'd make a motion a little bit long, but approve the intergovernmental agreement with Oregon Health Authority for incoming funds in the amount of $1,206,936 for Marion County to provide choice model services retroactive from July 1st, 2019 through December 31st, 2020.
And I'll second the motion.
Yeah, motion and a second. Any further discussion? Seeing none, all those in favor signify by saying aye.
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 Okay, we also have you under consider approval of contract for services for Bridgeway Recovery Services, Inc., with a not to exceed $1,901,182 for substance abuse and gambling treatment services, retroactive from July 1st, 2019 to July 31st, 2020. Welcome back.
Thank you. So as the action item indicates, I am not Sydney. Sydney is on vacation today, so I appreciate that she's doing something very fun today. So this item, let me just give you a little bit of background around our contract with Bridgeway. The Oregon Health Authority contracts with Marion County Health and Human Services to support addiction treatment services for folks who do not have Oregon Health Plan. So the Bridgeway Recovery Services has a full array of treatment services that we subcontract with them for. These services are to support any individual actually who needs treatment services. So the array of services includes the highest level of care, which is medical detox for substance abuse, all the way to outpatient services. And Bridgeway has contracts for Medicaid business and private insurance, but this is specifically for non-Medicaid or private insurance. And some of the services that Bridgeway provides, there are not, private insurance or Medicaid does not pay for. So then we become this service, and these contracts support that work. So medical detox, residential treatment. Bridgeway has the only inpatient residential gambling program in the state. So these dollars are passed through to us, and we monitor those contracts for residential gambling services. That's a highly, it's a critical population. They have high needs. They tend to have high mental health conditions as well as gambling treatment and alcohol or drug-related issues. They have a men's and a women's residential treatment program, and then a full array of outpatient services. So these contracts support that array of services.
So, Carrie, would this be, some of this is flowing through from Oregon Health Authority, lottery dollars help support some of this. So would this be somebody calls the 800 number? And,
Yes.
Okay.
Yes.
Got it. That's where this goes. All right. Any other questions? Take a
Okay.
motion.
Mr. Chair, I move that we approve the contract for services with Bridgeway Recovery Services Incorporated with a not-to-exceed amount of $1,901,182 for substance use and gambling treatment services, retroactive from July 1st, 2019 through December 31st, 2020.
Second?
Yeah, motion and a second. Any further discussion? Seeing none, all those in favor signify by saying aye.
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 Aye. Okay, thank you very much.
Thank you.
Thanks for your good work. Hope you're feeling better, Carrie. Okay, we're going to go on to our next item, and Frank, I see that you're here for the first item. We'll come back, all right?
Perhaps.
Yeah, yeah. So under information technology, consider approval of an intergovernmental agreement with the Salem Area Mass Transit District for incoming funds in the amount of $140,000 for leasing of space in Marion County Information Technology Server Room through June 30th, 2024. Welcome, Scott.
Good morning, Commissioners. Scott Emery for the Information Technology Department. This is one of the rare occasions that I'll come forward and actually say that rather than asking to expend money, it's actually to take money in. For more than 5 years, Marion County IT Department actually leased space to the Salem Area Mass Transit District to be able to store and house their servers. This agreement actually will allow us to get something on the order of $25,740 per year to cover the cost for things like not only covering the facility space, the electrical power, and of course the cooling for their servers. The contract goes for 5 years, a total agreement amount of $140,000 over the 5-year period of time, and I'm certainly happy to answer any questions related to this particular item.
Well, I do have a question. I hate to ask it, but I just feel like I have to. So that isn't space that we could use ourselves. There's never been a push that way.
It isn't. When you look at data centers, they come in larger rooms, and you pay for the whole amount, regardless of whether or not you use the full amount. You can only partition the room so much, so to speak. And it makes sense. We, for example, actually contract and actually have some of our systems in the city of Salem because that's our primary connection to the state, which is the internet. So it's not uncommon for us to lease small spaces, both internally but also externally, for these connections between partners.
All right.
Any other questions?
No, I don't. Okay.
Yeah.
Then, Chair Cameron, I make a motion to approve an intergovernmental agreement with Salem Area Mass Transit for incoming funds in the amount of $140,000 for leasing of space in the Marion County Information Technology Server Room through June 30th, 2024.
I'll second the motion.
In a motion and a second. Any further discussion? Seeing none, all those in favor signify by saying aye.
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 All right. Thanks, Scott. Aye. I should say aye.
Oh, yeah.
Yeah. Okay, we'll come back to action item number 1, which is under the clerk's office. And it's consider approval of a contract for services with Metro Presort, Inc. for ballot transport and printing of voter notifications and voter confirmation cards retroactive from July 1st, 2019 through June 30th, 2022, with a not-to-exceed amount of $185,000. Welcome. For the record, gentlemen, introduce yourselves.
Good morning. My name is Dan Brummer. I'm an election support specialist for the clerk's office.
Good morning. My name is Frank Melton. I'm with Marion County Archives, and I'm here to support Dan.
All right. Dan, welcome.
Thank you. So Metro Presort mails out all of our supplemental ballots. So we send an initial file for the ballots at the beginning of the election, but when we get supplemental ballots for address changes or updates that come from the Secretary of State's office, Metro Presort will come pick up our ballots and mail them for us, since we stuff those in-house. And then they also mail out our weekly VCC and VNCs, which are voter confirmation cards and voter notification cards. Those are sent to each voter when they register to vote, letting them know that we received their change. And then VCCs are sent out to let them know that we have an issue with their address, or they didn't sign their ballot, or we had an issue with their signature.
BCC.
Yes, voter confirmation card. So it's basically asking them.
V or B as in
V.
boy?
V as in Victor.
V as in Victor.
Yep.
So what was the second one, though, that you said, if I forget to sign?
So if you forget to sign or we have an issue with your signature, we'll send out a letter to you. But if you don't respond to that, then we send out a VCC to you to let you know that you're inactive and that you need to correct the information and send the card back to us.
All right.
And those are done weekly.
That happened to me one time. I forgot to sign my ballot.
Well, for heaven.
So if somebody doesn't sign their ballot or signs it incorrectly, when does the notice go back to them telling them that they need to?
So as soon as we have an issue with the signature, we'll send a letter out, and then they have until 14 days after the election to clear that information up.
Got it.
And if you don't pick up your mail for 14 days and 14 days later you pick it up, your vote didn't count.
Correct. And you're inactive, so you have to correct that.
Yeah. How do I know that?
Good question. How do you
Yeah,
know
I
that?
do know that. It's called Pick Your Mail Up.
If I
I
could,
read
just
it.
because I'm curious, are there other agent, or organizations, I should say, that do the same thing? Is this the only game in town? What?
I've only been here for 4 months, so I don't know of any other organizations in this area that does it. This is just the organization that we've used in the past.
Is this a special procurement, or is it?
It says an exemption to competitive process.
What's the, that was a 3-year term?
Yeah, it goes through 2022. All right.
Do you have any thoughts on that? As to, you probably don't know why it was
Probably
on
need-
this route.
Unfortunately, no.
So if you read, it says Finance Department is tasked with performing contract specialty duties. Finance was aware of the previous contract expiring June 30th, 2019, but believed these were services that were only performed immediately prior to an election. Consequently, the belief was that the execution of a follow-on contract would not be required immediately and could wait while other urgent matters were addressed. Week of August 12th, that these services were in fact an ongoing function, and contractor had continued to work after June 30th. The required staff will provide description of steps being taken. So, sounds like we have a little problem here. Jane, you see anything here?
Excuse me.
Well, it looks like, they want to extend this, or they asked to extend this particular contract or do a new one because this contractor's providing ongoing duties and they were caught a little flat-footed, so they got an exemption. One thing, you could do is do a shorter contract and then have a competitive bid process if you wanted to go that route.
So Jan, is this something we should probably talk with Camber and Jeff about? What do you think? Or
It
we're
looks
good?
to me like finance really would appreciate talking about it. I think because it's retro, because they weren't aware that the services were being provided, I think perhaps we should look at, perhaps, like Jane said, maybe 1 year and then look at going out for an RFP and seeing if there are other providers available.
Right,
I mean,
and if there aren't, then the contract review board could approve the sole source.
Yeah, it's not a lot of money, but it is one of those things. And Dan, since you're new, it might be advantageous for us to be able to do that. Can we change that right here? Can we change the term?
I think you could probably pull it, and we can rework the contract for next week
Okay.
and put it on consent.
There is
Oh, there's no
board
board session? Okay.
Hmm.
Can we do it at management
yeah.
update?
There is no management update, is
No,
there?
they're all
No,
going out
yeah.
next week.
Two of us are gone.
Well, you
Well,
can,
you're
you
going to.
can,
Like finance said, they'll sit down and work with the department again on looking at it and what the procedures are for actually following contractual rules and requirements.
I'm nervous doing a 3-year contract, though. I'd be more comfortable with a 1-year contract. Is there anything urgent in the next 2 weeks? That, like, if this doesn't get inked in the next 2 weeks, like, the ship will sink? Or is it something that,
I don't believe so, no.
there may be
There- there's-
It's by the
outstanding invoices.
election.
They're
time.
still mailing out our VCCs and VNCs. Is that contract still valid?
There may be outstanding invoices that we need to pay.
to pay? Okay,
Yeah.
so long as we make sure.
But we don't have any ballots to mail out right now, no.
Okay,
So whatever we do, we can make retro, but we can make it shorter and then, yeah. So you want to hold this over, so we want to hold this action item over
I
to?
think that's what I hear you
date
saying.
Next board
Yes.
meeting.
To,
management update.
which would
it'd be
be,
2 weeks from
19th?
today.
is it the 19th?
18th. it
We'll
should
talk
be.
with the clerk, set up a meeting,
Okay, very good.
come back with a 1 year for consent
Are you gonna be
calendar
here?
on the
It says
19th.
you're available.
It's
On the
18th.
Are you? You coming back?
Yes.
Okay, so,
And
Chair,
Bill and Connie should be back by then.
yeah, the chair would take a motion that we would hold open item number 1, hold over item number 1 to Wednesday,
The 18th.
September 18th.
Is it my go? I don't even know.
I think it's your go.
All right, so moved. That's how you do
All
it.
right.
And I'll second the motion.
So we'll hold over item number 1, contract for services with Metro Presort to September 18th. All those in favor signify by saying aye.
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 Aye. All right.
All right, thank you.
Thank you.
Great. Hey, welcome aboard, Dan. Were you in orientation?
Yes.
Which one of us was there? Oh, this guy?
Yep.
Oh, okay. It was probably very memorable if it
He's
was.
still here. It must not have been too bad.
Frank, thank you for supporting Dan today.
Could you hand me the papers, please?
Oh, we got a long calendar to read today compared to last week.
All
Sure,
right.
if you want me to. If you got other business to take care of.
Today is Wednesday, September 4th, 9 in the morning. Well, it's now 9:30. All right, yeah. And we're in board session in the Senator Hearing Room, 555 Court Street Northeast. Today at 10:45 a.m., we have a Board of Commissioners Chief Administrative Officer meeting with an executive session if needed pursuant to ORS 192.660 to A, B, D, E, F, H, and I, located in the Silverton Conference Room on the 5th floor of this building. It's 555 Court Street Northeast in Salem. At noon today, September 4th, we have a Woodburn-Marion County meeting located at Luis's Taqueria at 523 Front Street in Woodburn. Tomorrow, Thursday, September 5th at 7 in the morning, we have a Salem Area Chamber of Commerce Public Policy meeting located at the Salem Area Chamber of Commerce, 1110 Commercial Street Northeast in Salem. On Thursday, September 5th at 9 in the morning, we have calendar review located in the Silverton Conference Room on the 5th floor of this building, 555 Court Street Northeast in Salem. At 9:30 tomorrow, Thursday, September 5th, we have a department head elected officials meeting located in the Commissioner's Boardroom on the 5th floor of this building, 555 Court Street Northeast in Salem. At 10 a.m., we have a GK Machinery Customer Appreciation Day located at GK Machinery at 10590 Donald Road Northeast in Donald. Again, tomorrow, Thursday, September 5th at 3:30 in the afternoon, we have a Mid-Willamette Valley Area Commission on Transportation located at the Mid-Willamette Valley Council of Governments, 100 High Street Southeast in Salem, Suite 200. On Friday, September 6th at noon, we have SEDCOR Awards Luncheon located in the Willamette Room of the Salem Convention Center, located at 200 Commercial Street Southeast in Salem. On Monday, September 9th at 11 a.m., from 11 a.m. to 5 p.m., Commissioner Cameron and I will be in Washington, D.C., meeting with our congressional delegation and various agencies, talking about our needs here in Marion County. And then Tuesday, September 10th, from 8 to 5, there is a Alaska, Idaho, Montana, North Dakota, Oregon, South Dakota, Washington, and Wyoming White House Regional Conference located in Washington, D.C. And then on Wednesday, September 11th at 8 a.m., we have the National Association of Counties 2019 PILT Fly-In located in Washington, D.C.
That's the only one I saw.
I did them all that way. So.
Well, that's the only one you've dated so far that I noticed. It's 9. All right.
Well, while we're just sitting here quiet, I kind of have good news for you. Having just about 10 minutes before the meeting started, haven't met her yet, but it says Ruby Lynn Brentano was born in Salem.
Hey, congratulations.
I have something to look forward to
That's
this afternoon.
fabulous.
What all I got was big cheeks and dark hair. Sounds good.
Sounds great. Today will be a happy day then, huh? Are you going to see her?
Oh, sure, certainly.
Awesome. Good for you.
She was born in Staten, so that'll be easy too.
There you go.
Yeah,
Mom's
great.
doing okay?
Pardon me?
The mom's doing okay?
Yeah, it went real quick because I was just driving down and get a little graphic, but said the water broke. So then about 15 minutes later, I'm sitting here and said it's been chaotic, but she's here.
Quick,
So-
huh?
Mom's healthy and baby's healthy. That's all you can ask
Is
for.
this
you know?
Andy's second?
Yeah,
Yeah.
2 girls.
Yeah, I
That's
can relate to
awfully
that.
Exciting.
Well, anyway, that's my good news. Ruby Lynn, what do you yell? Ruby?
I really wonder why I keep putting these over there. It's like, why are you
Next to
close to
me,
me?
please.
Well, if you're just gonna sit there and sign, you should close this. If you have something important to tell the whole world,
Well, I wanted to tell the whole world it is September, not October.
well, these things happen.
These things happen. It's going by fast enough without you moving an extra month. It's like, oh my gosh, it's just flying by.
It really is.
Still having great weather. Isn't there some rain coming?
Yeah. They're talking
Tomorrow,
about big
right?
thunderstorms perhaps tomorrow.
Really?
Yeah,
Um,
coming in from the east.
So that'll be welcome relief as long as it's not dry lightning up in the mountains, because we've gotten through this year with some not,
Yeah, it hasn't been as
big
bad as
fires.
last, certainly.
they've been on them. There's been little ones breaking out, and they've been just
Well, our state and Boy Scouts cover it.
Yeah, there you go.
jumping on those fires.
Well, last
Yeah.
year was so horrible. Huh?
Well, and they were, like Kevin was saying, they were just thinking that's just natural, let it burn. Well, they got a good dose of that, isn't so good.
Yeah.
Isn't there one I just read about that they are letting it burn over in the east side someplace in the wilderness? That they're, said it's 70 acres. I just read about it in the newspaper, and they said it was only 70 acres, but they were gonna let it burn because by letting it burn this late in the year, it'll reduce the fire hazards
I think
later.
I saw something near Joseph like that, was it?
Yeah, maybe that's where it was, on the east side, yeah. You want me to adjourn? I will. Jane, any
Yeah, she
comments from legal over there?
It's all good.
It's been a good day when legal doesn't comment on us.
Jan, how's it been in the office with all these commissioners, like, doing other things?
We've gotten a lot of work done.
Yeah, that's what I figured. We get around and give you more work, all right. We won't be here next week. You're on vacation, right? Well-deserved
I
vacation?
don't know about that, but I'm
Yeah.
looking forward to it.
And hopefully that rain will bring in some
Wouldn't that be nice?
fish, and we can all eat fresh salmon.
I heard that.
Compliments of the
I
commissioner.
saw some evidence that
Yeah.
Barb might have caught one.
I
huh?
didn't,
Did Barb
she
catch
didn't
one?
share any? Is that what you're
I
telling me?
haven't talked to her. I've been busy yesterday, and she was busy, but
No, we
she
had
got
a-
one?
Yeah, we got two and lost a great big one, so that
Looked
was.
awfully
that was
On
big.
fun.
Friday or Saturday or?
Friday.
Friday. Lost a big one? How do you know? Wait, tell me, I want to hear about this one.
Well, it hit on my pole, and I gave it to Barb's husband, Waylon, and it came right to the boat. In fact, he had with line counters, it was 12 feet away. We can look at it right there, and I said, it's gonna get hot. And
It took off?
It turned and headed downstream, and it went from 12 to 100 just like that.
Whoa.
And then it just walked through line that's pretty heavy, as you know. So, yeah, it was
Took it
special.
all the way off the reel?
No, just broke it.
Yeah.
Yeah, it was going.
So you think it was like a 40-pounder?
It was over 30 anyway.
You got one big one. Though. How big was the big one that you caught?
No, just 25 maybe. It was nice, but see, fish aren't as big as they. So we used to see a lot of 30 would be
40s,
pretty
yeah.
average, and there'd be some 40s. There's talk of a 47 that's been caught, but that's really rare today.
That's a big fish.
I didn't see it.
Just because there's not as much food in the ocean for them, you think?
Whatever's
Yeah,
happening
yeah,
isn't as good.
Yeah.
No, I don't know all the answers. It's been 20 years since I bought the place in the Siletz. The first year I was there, and it was, well, not a longer story than you want, but I was done. I think I limbed it out. It sounded good, and I was literally up on my house cleaning the gutters, and I see a friend come by, and he's fighting a fish. And I remember hollering at him like, "You got a good one, Jim?" "Oh yeah." And then I heard didn't even look up really. Heard a little holler, and I came home, and the next day in the Statesman, it shows a picture of him with this like 60-pound fish, and I didn't even look at it.
Oh,
Wow. Wow.
But that was the biggest since my time, but that's a whole bunch bigger than 20. Anyway, it's my fun time of year, I'm
Well,
sorry.
good, I'm glad you caught some fish. That's good.
It's gonna be
Yeah.
hard, but
Right,
worth doing.
all right.
Better adjourn this thing.
Speaking of fishing, we're gonna go to DC and see if we can get some
Oh,
money.
yeah.
That's it.
Yeah, get some of our own
Try to
money.
get some of that
Good bait,
infrastructure.
yeah. So you can be punished for doing
No,
good?
we got some good bait, yeah. All right, we will adjourn.